A rotator cuff tear is an injury in one or more of the 4 tendons that form a cuff over the shoulder, holding the joint in place and helping it move. This can occur from a sudden injury or from wear and tear over time. Symptoms can include pain, weakness, and reduced mobility in your shoulder. For more severe tears, surgery may be necessary to repair the torn tendon. Surgery to repair the injury often begins with debriding the tendon to smooth or trim the damaged part. The surgeon will use suture anchors to reattach the tendon to the head of the humerus. The sutures are placed through the tendon and then tied to secure the tendon back to the bone. The amount of sutures required will depend on the severity of the injury. Successful treatment will relieve pain and restore strength to the joint. Support for this video is provided by Opto Health. Learn more in the description below and subscribe to our channel for more 3D health content.